My name is Angela. I work in advocacy at the European Pain Federation, and I'm joined by my colleague Mary, who is a researcher in EFIC as well. So Lars, would you like to introduce yourself briefly?
Yeah, my name is Lars, and I'm from Denmark, working voluntarily in an organization, a patient organization called FACS, the Danish Association of Chronic Pain Afflicted, where I've been for the last 15 years. And more importantly, I've been living with chronic pain, widespread pain, fibromyalgia for around 25 years. And I work at in various positions and areas, but I try to focus on health science and the international relations with people such as you.
Thank you, Lars. Iben, could you introduce yourself as well briefly?
Absolutely. So my name is Iben, and I'm the chairman of board of the same association in Denmark. And my focus is just trying to develop, our little society here in Denmark for chronic pain afflicted, and trying to make our voice heard and do a difference. I myself are having chronic pain. I was born with it, so I'm a little bit atypical, I think, for chronic pain patients, but definitely I feel the effects every day as well. So, yeah.
Thank you.
So, Iben, could you kick us off by introducing the Danish Association of Chronic Pain Afflicted? What is it?
Absolutely. So we are represented all over Denmark. We were established back in the 1990s. So we are a very old organization. And we've gone through a lot of development steps, coming from being a social oriented club, you can say, where people got together who had chronic pain, connecting over coffee, helping each other, to a large national, highly political organization today, where we still have two legs, or three legs, you can say. We focus on people living with chronic pain, offering tools, advice, and so forth, and also social communities in different countries around in Denmark. We focus a lot on the healthcare from a science perspective, participating in projects with various health institutions where they also develop tools for chronic pain patients. And then, of course, the political aspect, and that is to influencing treatment, the quality, waiting times, and of course, my personal focus is, of course, securing the organization via funding, relations, sponsorships, and so forth. So, but we are a very recognized, actually, organization and very highly respected as well. And we are invited both from politician side, but also healthcare professionals to participate in various discussions and so forth. So that we are very proud of. And that is at least a lot to do with all the volunteers. We are 100% volunteering in our organization. So that's a little bit of a unique situation as well. So we don't get any kind of pay and so forth. So I'm really proud of everyone who is, joining in the cause, you can say, but really helping us making our voice heard across the country. Yeah.
That's great. So there's a lot of commitment there. Could you tell us more about what led to the setup of this initially and the actual foundations then for the Danish pain plan?
See, originally it was just, as I mentioned, a place where people could, where patients, so chronic pain patients, could get together, and via, I think, relations, social interactions, have someone to lean on, to share experiences. How do you manage your pain? Do you have good advices? And that was patient to patient. Throughout the years, the need grew, and today we have 1.2 million people in Denmark diagnosed with chronic pain. So it's a huge amount compared to, if you look at the population of Denmark. And I think the foundation today is we have our board, who is kind of looking at the overall strategy and development of the organization. And then we have a lot of different, we call them areas of expertise, where we have people like Lars, for instance, sitting on research projects, other healthcare initiatives. We have an area of focus on communication. We have, of course, our office with a lot of administration and so forth. So we have divided it into expertise areas within the organization. And we heavily rely, as mentioned before, on volunteer. Because without them, this wouldn't happen. That is also a challenge for the organization, of course, that it is on a volunteer basis. So, but today we definitely still have a huge focus on our patient counseling. We actually in Denmark have sponsored by the government you can call it a counseling phone line where people can call in and talk to healthcare professionals, physical therapists, and so forth. We call it, you can call it the pain hotline, so to speak, if you translate it, yeah. And it's something where we can see a huge need for, and that is to share. And people have a lot of questions, and they can talk to us without any fear of anything being recorded. They can ask all the questions that they might be afraid of. Because we don't judge anything. We're just here to sometimes just provide a listening ear, but also sometimes provide some actual, counseling on exercises, and, how can you talk to your nurse, your doctor about your treatment and so forth. So, but it's definitely a highly needed area we can see in Denmark, and that is the need for, I think, more direct oriented patient communication.
And I would like to add the importance of, addressing the politicians on certain subjects. The pain line, the telephone helpline, which we have been running for, I guess, around 10 years now. It was kicked off by a meeting that we held with former Minister of Health, and then we got our hands on some money, some public fundings, which we have been given each year the last 10 or 12 years.
Fantastic. So, Lars, how much funding was allocated by the Danish government, and how did the goal shift to the national pain plan?
Initially, I believe it was around 14 millions, which were given or allocated to the area health politically. And one important point I might add is that this was primarily, I would like to think that we have something to do with it, all our, lobbying and all our activities for the last 15 years. But I think primarily it was due to the big focus which started around 7 years on the opioids prescriptions, high opioid consumption, primarily in the US, but also in Europe. So I think there was a big political concern about this area. And I think this was initially what kicked off the need for a national health plan. And if you go down and read the documents for it, it also mentions a lot about the goals being to bring down the consumption of opiates.
And Lars, how did FACS actually get involved then in the development of the plan? And what was your particular role in the process?
I think it kind of came naturally, a snowball, because previously we had been involved with a lot of different national, or not a lot, but some national guidelines in the area of chronic pain with the national health authorities. So when they wanted to reach out to it's very common, at least in Denmark, that when you do guidelines, you of course involve patient organizations or people with their know-how on the area. So they just wanted to reach out, but to an organization representing chronic pain as a whole. And most of the pain patient organizations in Denmark are very diagnostic specific. So I actually believe we are the only one that, you know, encompass patients with chronic pain as a whole. So I believe this was the reason that the National Health Authority initially reached out to us. I see Eben has a question.
No, it's more, you know, I think just collaborating a bit on your statement there, Lars, but I think also Facts has been known for being a constructive voice. We don't go out and criticize. So I think we have been very focused on how we address certain areas, both political, but also healthcare wise. And it's not because we don't have our opinions, we do, but I think we've always been very attentive to how we communicate things. And I think because we don't just sit and I think point and try to identify blame and focus on this and these areas are not working, this is done wrong and so forth, but we actually come to the table with ideas and solutions. I think that's also one of the reasons why we continuously get re-invited for these discussions. And I think that's definitely also a big compliment to the people like Lars and everybody else who participates in this. And that is to have that in mind, because we see it with other organizations who don't get re-invited, and it's often to do with the tone and the communication. Yeah, so just wanted to elaborate that, Lars. Yeah.
Yeah, I think it's very easy as a patient and a patient organization to, you know, to reach out to, you know, tabloids whenever you experience something that you think is unfair. But we strive to criticize more constructively, at least in the first place. I mean, of course we can use the media if nothing happens, you know, if it's like hitting you into a brick wall, but in first place we will always try to address it more constructively.
Absolutely. Thank you. And Lars, could you maybe expand on the objectives Facts suggested focusing on with regards to the pain plan?
Yeah, well, actually, the initial pain plan back in 2018, where I sat, I believe it was the process was around a year, where we sat with the national health authorities, with other health professionals in the area of chronic pain. We didn't come up. I don't really remember specifically what we recommended at that point, but we drew up a big amount of initiatives. But then I think it was in 2022 when it was when the pain plan was, how do you say, it was reinitiated. We went to I went to a meeting in the Ministry of Health where they asked us specifically to prioritize 2 or 3 initiatives. And there, of course, I spoke with Eben and the rest of the board, and there we recommended to focus on 1, try to bring down the effects of surgery, chronic pain due to surgery, post-surgical pain. How can we do that? Because we know statistically there's a lot of people each year going through surgery, and a certain amount of those patients will develop chronic pain and will develop a chronic consumption of opioids. So this was one of the aspects, one of the issues. The other one, I believe, was to bring better education for especially the GPs, the doctors, in their primary education, because in our perspective and to our knowledge, they have very little education about chronic pain. They have some about the mechanisms of acute pain, but so that was the second one. And what was the third one? I'm just looking into my papers here. Okay, yeah. The third one was to have more systematic trajectories for people with chronic pain in primary care. And I see some of these initiatives. They've been listening to us because some of them are part of the pain plan. But you know, we probably, as you do in other countries as well, experience a lot of unsystematic back and forth with patients with chronic pain between different specialties. So it was one of our aim to, is it possible to develop more, you know, standardized systematic trajectories for people so they can go through this process a bit faster.
Yeah, and I think that's definitely a problem outside Denmark as well. As you say, the post-surgical pain, lack of knowledge among health professionals, and this unsystematic collection of data, none of that helps. You mentioned initiatives, Lars. So could you explain the 5 initiatives of the pain plan, please?
Yeah. Well, actually, the first one, the kind of the way they have unrolled them has not been consecutively. So actually, we started with the. Oh, maybe let me answer your question and go through them, and then we can talk about which one have been kicked off. Well, the first one is recommendations for organization and measures in the area of pain. And well, basically, this is what I talked about. There is quite a big need for more organization and communication between different sectors and specialties, because people with chronic pain, at least people with what we today call chronic primary pain, you know, chronic complex pain, they will have various symptoms from various systems, and it's multifactorial. So it's very important to develop an organizational structure to facilitate this or to help this. And also, just I believe one of the problem in this area is the, how do you call it, the resources lacking for this specific area. But I don't think that, yeah, then I need to address something with the whole plan that is kind of an issue. That is, the national health authorities and the Minister of Health told us when they initiated these initiatives that this was within the existing economical
situation.
Yeah. So no additional fundings were made for the pain area besides the 14 million to draw up the pain plan. So this is also why we can talk a little bit about this later. But this is one of, I think, one of the problems, that you make a pain plan, but can these recommendations in fact be implemented in reality? So, but you were asking about the 5 different initiatives. So the first one was like kind of an organizational, structural thing to look at this. How can we be better in that area? And the second one was to make national recommendations for the assessment and, I believe it's called, treatment in of people with chronic pain in general practice, because you know, general practice will see most of the patients, and even though you are referred to interdisciplinary pain clinic, eventually you will finish the treatment there and go back to your GP. So this is a very important area. So yeah, and that was the second initiative. And the third initiative is the inclusion of patients with chronic pain. And that covers more specifically that they wanted to use or wanted to develop a patient-reported outcome measure, a tool to be used, I think, in general care, because they already use one in the interdisciplinary pain clinics. But so to develop a screening tool with patient-reported outcomes, where you look at what is important to the patients and what is important in order to know how the pain will develop. And then the fourth initiative was raising awareness about chronic pain, and this is basically a campaign where they actually, I believe it was last week, they released some videos which were, you know, they have tried to find some musician that are kind of famous, probably just in Denmark, but in order to, you know, to gain the interest from the general public about chronic pain. So they made some videos. And then the last one is that they, in the end of all these initiatives, they will invite people with an interest in pain area to some kind of meeting where we will discuss the area of chronic pain, and yeah, hopefully it will facilitate something great or better. Yeah, I think that was a shorter.
And Lars, of those initiatives, so you said the campaign kicked off last week. That's right. Will that be an ongoing thing?
I think the economic, the resources for it were just to make. Even, do you know how many videos have been published at this point, or?
Well, I think they've made it a national campaign, but it's not going to be an ongoing one. There's simply not budget for it. So they had actually, part of the content was something they used a couple of years back, still a very powerful, strong video. And then, as Lars mentioned, they now added some interviews with a musician who is known in Denmark who lives with chronic pain to kind of, I think, make it a little bit more new, but it's definitely not an ongoing campaign. This is going to be an effort. I think you'll see they will be pushing out for a couple of weeks. They already reached out, for instance, to me about, oh, can you please share it, which actually fully indicates that there's not budget to make this a long-term campaign. Of course, the content is always available, but they are not going to spend a lot of funding on it. Quite sure of that, yeah.
And are there any pain research groups within Denmark that would be interested in applying for funding for such a campaign? Because, you know, we know from other health campaigns that it's really exposure over time. You have to be, you know, repeating those messages to actually, you know, get it into the public consciousness. Any collaborations with research groups that want to maybe test the effects of a campaign or anything like that?
I think actually we could find, but it would I think, to be instigated by an organization like ours, where we go out and find different partners. I think it would be doable, but it definitely requires funding of a large scale if you need to go national. Because one thing is TV. You know, we've been looking into making adverts on buses. We have city buses who drive all around the country. We in cinemas, which is also hugely popular, newspapers and so forth. But it's definitely, extremely expensive in Denmark. But we do work with different communication agencies where we can find different partners, but it is a huge undertaking to do it. And we always have to balance, I think, the motives for joining into these kind of campaigns, especially if we are looking at, I think, medical companies who would love to actually sponsor these type of things, but there is a very fine line here, as you also are aware what they can do. They already help us now by funding and so forth, but it's not directly campaign initiatives. There we have to go out and apply for, I think the word is scholarships of these type of things. You have different type of companies where you can apply for funding for these type of things. Yeah. But it's I think it's a massive undertaking to do it, but you would be able to find interested parties, I think, to do it, because it will not come from the government. I'm pretty sure they will not set aside additional funding for it.
Yeah, I guess the cheapest way would be probably social media, but even at that, it wouldn't be cheap. As you say, TV might be seen by more people, but it's very expensive.
Yeah.
I just want to follow up there on one of the initiatives you mentioned, the third one, I think, Lars, the development of the patient reported outcome measure. Is that kicked into motion, or is it something that's ongoing?
At this point, it is ongoing. They actually, this is not held within national health authorities. This is, I believe, it is run by the health data authorities. And they reached out to us, I think it was around 2 months ago, about starting. The initiative will start after the summer vacation, but they just reached out, and I had a short meeting with them, giving them some inputs. So I believe that after the summer, it will be kicked off. And hopefully, I mean, it has been our goal for many years, in order to, address the unsystematic assessment in general care of people with chronic pain. We really would like general practitioners to have like a short screening tool of some sort, which can make it more systematic. But on the other hand, I know for a fact that many general practitioners are overburdened by a lot of tools they have to and data that they have to register every time they see a patient. So in one of the initiatives, the second initiative about the assessment, recommendation for assessment in general practice, we initially had a lot of how do you say, negativity from the general practitioners in the working group, because I think they are used to a lot of different healthcare areas. They get asked for doing newer things all the time, and they are so overburdened as it is. So, but I actually think we made some way with them after we have been in that working group for half a year, and it's actually starting to show some positive perspectives. And that's the second initiative.
Excellent.
So, yeah, but it it takes a lot of discussion back and forth, and to be honest, we really never had success with reaching out to general practitioners. We have, as Eben said, we have a lot of good connections with the specialty of chronic pain and doctors, but specifically primary care and general practitioners, it's been really difficult to get them to talk with us.
Yeah, and I think that's common across countries for research in general. GPs are just so busy, they deal with so many different areas. But as you said, Lars, they're really the gatekeeper. You kind of start and finish with them as a patient. So having them informed, is really key.
Well, we've seen a development that they are now reaching out to use the materials that we publish. We publish pamphlets on different areas, like how getting good sleep patterns and behaviors and these type of things. We have different pamphlets we have been publishing, and we see an increase actually from the general practitioners to use those. But so we definitely are starting to, I think, getting the door just a little bit open, but you know, there's definitely a long way, and they are. I'm not sure it's because they don't want to. I think they simply cannot. They can't. On top of everything else, as you also mentioned yourself and Lars, it's simply too much. Even if we provide them with a tool that can actually help them, I think they selling that it can help and actually make the screening more efficient and much better for the patient and for the doctor. I think it's very difficult because you really need to sell it in a way, and I think you need to actually get that push from the politicians if we need to have such kind of tool.
Yes.
We know there's an interest actually from medical companies to pay for all the development of such a tool. But that poses another type of conflict, of course, that you have to look into. But
Yes.
so you can actually get the funding for it, but it's definitely a tricky area. But we are seeing a slight difference in wanting at least to, I think, as Lars mentioned, engage in dialogue. So I think that's a step in the right direction, but it's a very long road and journey to get them on board, I think, yeah.
For sure, yeah. I see in other countries, some people are trying to introduce some intervention in the waiting room for pain, you know, maybe having more information. I'm not sure about screening tools, but yeah, it's trying to find a scalable tool for the GPs, I guess, which is very hard. But these are very ambitious initiatives. It's great. You know, it'd be great in 10 years' time to see, you know, where they are and has it changed things.
I think one important point will be that can we as a small organization rise with the challenge and take these initiatives once they finished and once they are written on paper, you know, the recommendations, can we go to the politicians and say, hey, this is what the recommendations are, and they do not reflect reality. How can we do that? And, you know, in this time with the economy, and, you know, it can be, of course, it will be quite a bit of a task, but maybe we can team up with some other bigger organizations, you know, or, you know, get the help from, you know, internationally with organizations such as yours. I remember, for example, back in, I think it was 15 years ago, when I just got into the area, we were not able to seek the public fundings in Denmark to be a patient organization because they didn't describe chronic pain as a disease. It was merely a symptom. So I reached out to, I think it was one of the former presidents of the Afflicted, and got them to write a paper, which I handed in to the Danish health authorities, and then we got approved. And from then on, we have been able to apply for these fundings. So that's just an example of how you can use your network.
It's great.
Eben, could you maybe talk about a bit chronic pain and the societal impact of pain?
I think for Denmark, we are seeing that I think the landscape of people living with chronic diseases, including chronic pain, are increasing. And I think in Denmark, like a lot of other European countries, we are seeing a decrease on the workforce. And because we have a challenge on waiting times for getting the proper assessments following by treatment, for instance, then they have to be followed up with some quite rigorous processes within their local community, where they actually get, could be social benefits and these type of things. We are experiencing chronic pain patients being in the system, not working for years. And so they actually lose connection with, the workplace. A lot of them actually loses their job or quit themselves because it's simply too overwhelming with the chronic pain. So we are seeing a huge impact there on the workforce. And we are very active in that debate as well, in terms of making space for chronic people with chronic diseases, not just pain, but especially pain. We need to redesign how the whole workspace works, because we have a lot of people who can't work full time. But there are a lot of design and flexibility we can look into that. And we've initiated that discussion and also went on national TV, which was a great opportunity for us to showcase also chronic pain specifically, because it's an invisible pain. So we see a huge economical impact on the society because of this, because people simply are not active in that area. The other part is definitely we see an increase in isolation. People are withdrawing, and I think it's of course a matter of coping mechanisms, which is not being addressed in the best possible manner. I think giving the chronic pain people tools so they can actually navigate in this, and this is where we need to look a little bit further than just medicine and these type of things. We need to make sure we look at the more personal aspects, because that isolation is damaging both for the person itself, but also all the relatives around them. And there we are, unfortunately, a little bit of a huge competition with some of the larger political agendas at the moment, which is we have a general problem in Denmark if people need psychiatric assistance. And you could argue that pain patients actually fall under that group, but they don't, because they're not considered having same type of challenges as other mental illnesses that needs to be addressed. So they're kind of left a little bit behind and have to go out and seek that counseling on their own. And that self-empowerment can be extremely hard to muster, I think, especially if you are starting out with chronic pain, you need to readjust your whole life. Then on top of that, finding, that extra energy to go out and get that counseling and finding out which tool works for me, it is really extremely difficult in what we see. So we are seeing, at least that's what we're hearing. Again, the data is not really always the best in Denmark still. I know that's also an initiative Lars is working on. We are seeing that we are having, I think there's an increase in patients who actually get removed from the chronic pain list. So they have chronic pain 3 to 6, 9 months or even longer. But as I think some of the treatments develop, we also see people are getting off the list again, which is definitely very promising. But again, we see it is mostly due to a person's own effort in constantly seeking new treatment possibilities. It's not something that comes automatically in the assessment process by the government. So, yeah.
I would like to just chip in on the whole thing about, gaining the politicians' interest for this area. I briefly addressed that the reason actually for the pain plan was the opiate consumption. But also, as Eben points out, there's a big interest between different political organizations in the area of, the workforce. So if you can use this area in order to gain more speaking time in the public, this might also be a really good way to address the problems of chronic pain. Because if you just speak about chronic pain, it's really difficult to get the attention of the politicians. And it's also very difficult to show them specific numbers due to, in the past, hopefully it will be better with the ICD-11, once it will be implemented, and it will be some of the whole nomenclature of it, the whole system will be transferred to the ICPC tree, which are the system that the general practitioners use because they don't use the ICD system. So maybe 10 years from now, we will have much better data on people with chronic pain, but that's a different issue. Once we go to the politicians, very difficult for us to show them specific numbers. We have the numbers as even suggested, like the 1.2 million, which is a survey that they send out for 20,000 people every fourth year. And that is self-reported chronic pain, which is around 1.2 million people. But more importantly, I think the estimate is that around 6% are living with what we would define as chronic complex or chronic primary pain, and those are the people that are really, expensive.
Absolutely. And just to finish off, Lars, what would, in your opinion, be the next steps in order to keep the momentum?
I definitely think that once we finish this whole national pain plan needs to be finished, I think in the end of 2023. I think we will need to go the political way, and also probably because, as I say, we are in fact a small organization primarily based on, or only based on, volunteers. We need to reach out to health professionals and organizations, international such as yours, to take these recommendations and put them into some sort of effect.
So that was an excellent discussion, Lars and Eben. Thank you so much for joining us. And I'd love to hear more about the progress, if there's any, major milestones or achievements, to let us know, and we could chat again. But that was excellent. Thank you very much.
Oh, you're welcome. So it's very interesting work, but I also know it's time consuming, and I also know that you really need to be very meticulous about reading a lot of material, but also to keep up the professionalism and the insight that, for instance, Lars has. It's a lot of work, but I think it's part of what is the most important work that we do, exactly because we can influence. But I think keeping the momentum once they finalized it is definitely going to be a challenge for us as well. And there, I think we need to team up, of course, to make sure. But it is definitely very, very important work that is happening here. And I think we also have a little bit of pride involved in it, right? Because we get invited, they do value our input and so forth. So we'll take that, with us as well. And that's also what I think keeps us motivated in doing it. Yeah, because we are at the table to some extent, at least. Yeah.
Yeah, and we'd hope that it would provide inspiration for other countries as well. And
absolutely.
You could see, if you saw multiple European countries working together on this, it would be amazing.
Thank you. Thank you, everyone.